When it comes to gender affirmation top surgery for folks assigned female at birth, there are thankfully lots of different options in order to get the most affirming result for the individual patient. But the paradox here is sometimes this can make deciding exactly what look to go for a little bit complicated. So what I mean is we can choose from nipples, no nipples, flat top surgery, non-flat top surgery, a radical breast reduction, where maybe we keep the nipple attached on the inside. Then we have to think about the shape of the chest after the surgery. Are we going to want it perky or more flat? There are lots of different options. And sometimes I will consult with patients who are having difficulty deciding or envisioning what exactly is the goal in their particular case. And in this video, I'm going to talk about 3 different pieces of advice I have for those patients and strategies in order to figure out exactly what would be the most affirming for you. So, in a lot of cases, probably about 60-70% of folks I see who are undergoing top surgery, they'll ask me for a natural masculine look. And in those situations, it's very easy because we know the natural sizes, dimensions, and ratios that the patient prefers. They may show me pictures for specific preferences they have, because obviously no 2 male chests are going to be similar. So some folks may ask, for example, for differences in nipple placement, like a little bit more spaced out or closer to the middle, nip size differences, things like that. And then there are other patients who are really unclear as to whether they even want nipples at all, for example. So in those situations, the first thing I advise is get educated. Figure out exactly what you're signing up for by having nipples. Is it really true that your nipple is going to die and fall off? It's not. It's usually 97% of the time it can be fine. So sometimes those difficulties in deciding can just come from a lack of information. Thankfully now there's decent online resources. I have a ton of videos on that. I can also recommend this book I wrote about 2 years ago with 9 different specialists in the field. It's called Affirmed. It's available on Amazon, and that will just give you general information overall as to what exactly you are signing up for when it comes to top surgery and the different options. Number 2, it might be a good idea around this time to consult with your surgeon and just make sure that, for example, if you're doing non-flat top surgery, that is something they can actually offer and that they're able to show you before and afters of their own results. Now, number 3, speaking of before and afters, for most of my patients, especially folks who tend to be quite visual, before and afters are super useful. And as patients have described it to me, typically they'll go through tons and tons of before and after patients, paying special attention to folks who have their own body type in the pre-op picture and the before picture, because of course that means the after result is most likely going to be possible in them. So look at as many of those as possible, and patients describe that just sometimes different results will resonate with them and they'll feel it, they're like, that's the one, no nips, or whatever the case may be. And so I also encourage folks to choose their top few pictures, their inspiration pictures that they like, and typically we'll review them on the day of surgery as well, just to make sure we're on exactly the same page when it comes to the results we're shooting for. So those are my top tips if you're having trouble envisioning your result, and I hope this helps.